The theme for the next session is Outcomes of the Pre-Events of Second Meeting of NPDRR. This session is being chaired by Shri.Kamal Kishore, member NDMA, co-chaired by Shri Bipin Malik, Additional Secretary, Disaster Management, Ministry of Home Affairs. I request Shri Pawan Kumar from NDMA and Professor Santosh Kumar from NIDM to please come up onto the stage. श्री कमल किशोर पिछले 22 सालों से डिज़ास्टर रिस्क रिडक्शन और रिकवरी से जुड़े मुद्दों पर काम कर रहे हैं, चाहे वो लोकल लेवल हो या नेशनल या इंटरनेशनल या ग्लोबल। श्री विपिन मलिक कोयना में अर्थक्वेक और सतारा में फ्लड, उड़ीसा के सुपर साइक्लोन के दौरान बहुत ही महत्वपूर्ण भूमिका निभा चुके हैं। 2013 में उत्तराखंड क्लाउड बर्स्ट के दौरान भी आपने बहुत ही अहम भूमिका निभाई थी। Professor Santosh Kumar from NIDM is also there, and I request Shri Pawan Kumar from NDMA to please take over. And now I hand over the floor to the chair, Shri Kamal Kishore. Thank you.
Thank you very much. So the whole idea of the National Platform for Disaster Risk Reduction is to promote an all-of-society approach where it's not just all the levels of government, but the academic institutions, the civil society organizations, national and international, as well as the private sector, participate in the process of disaster risk reduction. You saw an introductory film at the opening ceremony, which basically the main message of the film was that disaster risk management is everybody's business. So in the run-up to the national platform, the idea was that, everybody is saying it's a big event, 1,200 participants, but even 1,200 participants in a large country is a very small number, and we need to engage ever larger number of people in the disaster risk reduction endeavor. We need to enlarge the discussion. So in the run-up to the national platform, to achieve that, a series of pre-events were organized, not just in New Delhi, but all parts of country. There was one in Hyderabad, there was one in Chennai, there was one in Mumbai, and many other places, and on a wide range of themes, from how to engage the private sector to what do we do about disaster risk management in natural heritage, cultural heritage, hazard-specific events focusing on what do we do about heat wave, an event discussing what have we learned from the implementation of National Disaster Management Plan over the last 1 year, how do we need to reform that, and engagement with the resident commissioners of all the states, another event focusing on school safety. So really a very wide range of pre-events were held as an input, as a sort of run-up to the national platform. So it is not possible to have a full summary of all the events because there were so many. So we thought before we get into the main technical session 1, 2, 3, 4, 5 aligned with the Sendai priorities, let's take a look at the summary of what happened in these pre-events, what came out from it, and how are we going to take the outcomes of those pre-events forward as we move ahead with the implementation of Sendai framework and the Prime Minister's 10-point agenda. So with that, now I would like to invite my colleagues, unless my co-chair wants to make a remark at this point, or you want to speak later? So I will ask my colleague Dr. Pawan Kumar Singh from NDMA. He will present an overview of 6 or 7 events that NDMA co-organized with other players in other parts of the country.
Good afternoon, everyone, and thank you, Chair and Co-Chair. The second meeting of National Platform of Disaster Risk Reduction has been convened to cater to many issues of utmost importance and impinging nature. Besides many other areas of concern, some of the key expected outcomes of this NPDRR are to sensitize the participants about important initiatives at global and national level, including AMCDRR 2016, the Asia Regional Plan, which was adopted on 5th of November last year, and Prime Minister's 10-point agenda, to facilitate the state UTs for conducting multi-hazard risk vulnerability assessment, and as after every year the economic loss is increasing, to explore the risk transfer and insurance mechanism as an alternative measure, to explore possible projects and schemes for earthquake, floods and landslide, and to measure and monitor the performance of India on different priority areas and targets of Sendai framework of disaster risk reduction. To build the momentum for these challenges, issues, and to create the environment for detailed discussion and debate, NDMA during the first 4 months of this year organized 7 pre-events which are as follows. The first one is the National Workshop on Preparation of Heatwave Action Plan, organized at Hyderabad, Conference on Capacity Building on Disaster Management, Hospital Disaster Resilience, Roundtable on Disaster Resilient Infrastructure, National Workshop on Sharing of Best Practices and Lessons Learned under the NSSP, 2-day workshop on NDMP, National Disaster Management Plan, and the last one was training workshop on disaster risk reduction in heritage sites, natural and cultural. In NDMA in 2016 last year, formulated and released the national guidelines for the preparation of heatwave action plan, and after that a series of events is conducted, video conferences with all the heatwave prone states, and then even activated the social media for the do's and don'ts. This year, to start early in the season, we organized in collaboration with Government of Telangana, we organized a 2-day national workshop at Hyderabad on 22nd and 23rd of February. The goal of the workshop was to guide states in operationalizing the heatwave action plan, and around participants from 10 states and various technical agencies attended this workshop. The 5 technical sessions organized during the workshop were preparation of heatwave action plan and risk reduction, experience sharing of the heatwave prone states and implementation of the mitigative measures, early warning and forecasting of heatwave, effective governance tools for increasing resilience to heatwave and monitoring, and the last one was review and updation of heatwave action plan. The outcome of the workshop is that immediately after the workshop, an expert group was constituted to review and update the national guidelines, which is underway and which will be revised very soon. The print and electronic media campaign has been organized from 1st of April on a target group basis. We have activated the social media for do's and don'ts, and the 10 TVCs have been uploaded on the YouTube, and video conference in the month of April last year in the 4th week. We have organized with 17 heatwave prone states. For the second pre-event, as envisaged in the National Disaster Management Plan and National Policy on Disaster Management, that there should be institutionalization of the capacity building. NDMA organized on 3rd of March a conference to review the capacity building of various stakeholders. The conference was conducted with particular reference to armed forces, Central Armed Paramilitary Forces, State Disaster Response Forces, Nehru Yuva Kendra Sangathan, National Cadet Corps and Civil Defense, in order to improve upon and optimize their current capacity and to train for disaster response, the training activities and the calendar of training. And then in the scheme of Abda Mitra and the financial assistance of rupees 1 lakh to each districts to run mock exercises on IRS model was also discussed in the conference. The focus point of the conference was as under review of training conducted during 16-17, content and duration of the training of first responder, budget implication for training of the first responders, the strengthening of disaster management wings of the Central Armed Paramilitary Forces, feedback on integration of armed forces and CAPF in DDMP and SDMP where they are locally available, and integration of training and deployment of civil defense volunteers with fire services as first responder. As an outcome of this conference, the scope of ongoing training during 17-18 has been enlarged. The number of participants from civil defense has been increased. To make the hospitals functional and operationally stable, a hospital disaster resilience meeting in collaboration with Asia Disaster Preparedness Center, Bangkok, was conducted on 29th March. The meeting was organized conceptualizing the need for hospital safety as a national priority, and as the concept of green and efficient hospital buildings is being accepted worldwide, and to align it with the DRR issues, the climate change framework, and the sustainable development goals, there was a need to have a structurally safe and energy efficient green hospitals. Then the issue of strengthening hospitals, regular capacity building exercises, existing training programs reviewed and analyzed, a roadmap suggested for standardization. This meeting was attended by senior officials from NDMA, World Health Organization, Ministry of Health and Family Welfare, National Institute of Health and Family Welfare, Hospital Boards of India, International Committee of Red Cross, Indian Medical Association, National Accreditation Board for Hospital and Healthcare Facilities, All India Institute of Medical Sciences, and Safdarjung Hospital. The future agenda of the workshop is to streamline the efforts being undertaken by various institutions. A list of organizations has to be compiled, and a standardization of existing training programs needs to be done. Based on NDMA guidelines on hospital safety modules have to be prepared. On 1st of April, a roundtable discussion was held on resilient disaster infrastructure in the margins of New Development Bank annual meeting, and this event was organized in collaboration with National Institute of Public Finance and Policy. The participants included the representation from UNISDR, Asia Development Bank, Asia Infrastructure Development Bank, New Development Bank, World Bank, private sector infrastructure lenders, infrastructure developers, insurance companies, academics working on the subjects, and Government of India. The roundtable discussed the following 4 areas of collaboration. Assessing disaster risk. To assess disaster risk system that can comprehend and that can capture and update the comprehensive data on infrastructure and disaster needs to be established on a broad timeline basis. Then the standards of design and implementation and good risk management practices in infrastructure projects. It needs to be put in place to state-of-the-art engineering technologies. Financing new infrastructure and mechanisms for covering risk. Some risk, especially that emanate from the low frequency, high impact disasters, have to be covered through mechanisms that diversify this risk. Insurance can be a good option. Then mechanism for supporting recovery in infrastructure sectors after disaster, the predictable and reliable public finance mechanism, and then to create a facility, financial facility that supports infrastructure recovery needs to be in place. A national workshop on sharing of best practices and lessons learned under NSSP, which NDMA has implemented in 8,600 schools in 43 districts of 22 state and UTs, was organized on 7th of April. The objective of the said workshop was to get an updated status of project implementation and to gather insight into good practices, challenges, and lessons learned from the project state for planning any upscaling of the school safety program in future. The outcome of the workshop is, based on the inputs received from the various project states, an inventory of the best practices and NSP will be synthesized. The states were requested to send school DM plans formulated on some of the schools, and the states were also requested to share details of the process of rapid visual screening and retrofitting undertaken for the designated schools. A 2-day workshop on National Disaster Management Plan. As per Section 11 of the DM Act, a plan has to be prepared for whole of the country, and the plan was prepared by NDMA and adopted by Government of India on June last year. And to review and update the plan, a 2-day workshop was organized on 12th and 13th of April. The objective of the workshop was to seek views and suggestions of all the stakeholders on National Disaster Management Plan. During the workshop, states, ministries, departments of Government of India, central agencies, academic institutions, civil society, former members of NDMA, members advisory committee NDMA attended, and the plan provided a framework for disaster management in the entire country, and the execution involves all levels of government from PRIs, ULBs, NGOs, civil societies, and vulnerable communities, Based on the deliberation of the workshop, and to NDMA has separately written to the states, and the suggestions have received, we have received the suggestions, the NDMA is being reviewed and updated. A training workshop on disaster risk reduction in heritage sites, natural and cultural, was organized on 14th to 19th of April in collaboration with Tata Institute of Social Sciences in Mumbai and Wildlife Institute of India. The course was delivered to a small but focused group of participants from diverse backgrounds. The course was divided into two parts, the natural heritage and the cultural heritage. The natural heritage theme was described through case examples of UNESCO World Heritage Sites in India, an introduction to the ecosystem approach toward disaster risk reduction, exploitation of natural resources. The cultural heritage sites was given, the cultural heritage site was discussed to the problems or the disasters being faced by the cultural heritage. The training was imparted through small exercises in the groups. As an outcome of the workshop, the National Disaster Management Guidelines of the museums has been finalized, and then NDMA is in the process of exploring the possibility to institutionalize these training courses with the help of National Institute of Museumology and National Institute of Disaster Management. Thank you.
Now, Professor Santosh, may I ask you to?
Honorable Chair, Shri.Kamal Kishore ji, Co-Chair, Shri Malik Saab, Additional Secretary at the Ministry of Home Affairs, distinguished delegates, friends. This is an important event which we had chosen very carefully in terms of that all the pre-events which we organized. The topics which we had chosen for this all pre-events with the premise of three basic principles. That was that building kind of a leading to the outcomes of this probably would contribute in the framing of the outcomes of the national platform. Second, that how that it is linked with the Sendai framework of disaster risk reduction and Honorable Prime Minister's 10-point agenda. Then how it is going to be inclusiveness in terms of that various stakeholders are engaged with. So these were the three basic premises, and we looked at that how disaster happens and what kind of a impact it actually leaves, which we have been discussing since morning. So Mr. Thirupuga has explained it very nicely, and you see this, our concern is that all post-disaster to the pre-disaster movement. So this was we altogether organized 7 events with the partners, and partners were from the private sector. CIA was the partner, UNICEF was the partner, Sphere, the group of humanitarian workers, and also that institutions, national and international, they got together and we worked in a very close coordination. And also we got constant support for the Ministry of Home Affairs as well as the National Disaster Management Authority, being as a resource person and also facilitating the process. So first of all, I would like to extend my heartfelt thanks to all the co-organizers of the event and all the participants and delegates who were there in this process, and the distinguished resource person for that entire different kind of deliberations. So this was the first session which we organized, the Climate Change National Consultation and Disaster Risk with the UNICEF in Chennai. That was very, very large number of participants attended. More than 400 people were attended in this particular workshop for 2 days. And this workshop, which we stand for that why we are talking about climate change, and these are the issues on DRR, because we want to work for the inclusiveness, and we say that I too have to smile with you. You don't have to go for always that in a kind of a crisis mode and all. The second commitment is this all 7 activities which were leading to making sustainable development resilient. So that solutions which we looked for, that this is the larger agenda, and we are saying if there is a big hole in the pocket which is happening due to disasters, how we are going to actually protect the investment, which Mr. Thiru also mentioned, in the morning session, if that resources are getting depleted constantly with the impact of disasters, whether we would be able to achieve sustainable development goals or not. And the two challenging tasks which we had when we were planning all the 7 events, one is this unfinished agenda of HFA and unfinished agenda of the Millennium Development Goal. So that was the additional carrier with the baggage which we had, that we had to carry it forward. We were not leaving it and then moving it forward. So how best kind of a thing we can bring it out. So the first session on the climate change, we are putting the most important, there are many recommendations. We are just putting 4 or 5 recommendations from each sessions. So I will not read much into the text is there already, but I will just highlight that's talking about leverage on science, innovations, and technologies for addressing the needs of the vulnerable communities. This came as one of the most important kind of recommendations when we organized this as a partnership pre-event. Also, that leverage on the capacity of the private sector, it's not only the government sector alone responsibilities, that core competencies, strength and assets what they have, and we can build upon that in terms of achieving the agenda of the Sustainable Development Goal. And the most vulnerable groups that should be addressed in a very distinct manner, in a more inclusive manner. Like we look at the Vigyan Bhavan, which we are saying this also is not very inclusive. Like if we say that if somebody is physically challenged, they have to access the dais, probably they won't be able to make the access. So how our buildings, how our facilities, how our resources have been designed, that is not a very, very kind of an inclusive manner. So we have to relook in terms of that how we are designing our buildings so that whatever investment we are making, that should be based on inclusiveness. Then an important point which I would like to highlight in this, the last point of this particular event which we organized in Chennai, National Corporate Task Force on Disaster Management, by inviting lead networks of the industries, have to be established. So there was a recommendations that whether the small industries or the big industries, they should be brought together, and consortium of associations of the industries also should be taken on the board in terms of, whether into terms of advisory or whether there's a kind of a as an entity which can contribute and interact with the NDMA and NIDM at the national level. So the second was that pre-event revisiting safety of schools and school children. Mr. Thirupuga has already mentioned about that in the responding to the question that how that national safety program which is being taken. This was organized, and in the pre-event it came very loudly that a school program, a school safety program should not get confined to the premises of the school alone. Because disaster happening on the road also, when children, we leave our children to the school bus or to the any transport, and we are not actually assured when unless and until children comes back to the homes. Our phone is on alert, whether what kind of this information is coming. So we wish to make sure that if we wish to make our children safer, we have to come out from the school premises and make home to school and school to home. So the home to home as a kind of a holistic framework for the school safety program. Secondly, viable building technologies. Is technology which we are introducing in the school safety programs should be very, very viable and cost effective, and also with the application of the traditional method and technology. The third important is how many schools which we find into the vulnerable zone 5 and the 4 to start with. And let us take that program as a national program on retrofitting of the existing school. That should be a kind of a principal option. That could be identified and taken as a kind of a mission mode so that we can reduce our risk in terms of school children risk, identified risk, located risk, and times to come with the 15 years of program which we are making forward. The last point of this is school safety, including children. Like the children must be in the center stage when we are making plan for the risk reduction of the schools. Normally, they are not included in the planning process. So how the voice of the children are also heard. So this particular engagement, this particular program was organized with the UNICEF and also the Save the Children. And many global experiences and national experiences were discussed. And finally, we came with the many, but 4 which we have identified this. The third important initiative which we had in terms of pre-event, socially inclusive DRR, leave no one behind. So this was the chaired by many organizations, many institutions were involved, with the lead of the Sphere Humanitarian Organization. And here we could locate that inclusive DRR alliance or collective action and task force of inclusion at the community level to be taken into action. The second important was brought into transgender and the relief distribution. So transgender came as a very loud kind of a intervention that if we are talking about inclusiveness, this particular group should not be left out while making the planning for the inclusive DRR. So their engagement also in planning and also as a volunteer. So both ways there should be seen, and almost in all the stages of DRR planning, their engagement should be brought in. Then integration of sexual and reproductive health issues should be brought into as a kind of a mainstreaming. That discussion went on that we are making heavy investment into a kind of a WASH program, health program, food and nutrition program, but they all are getting implemented as an isolated category. So there is no convergence when we are talking about not only understanding risk, but underlying risk factors. So this is very, very important to be addressed as an underlying risk factors, why communities become vulnerable. So these are the points to be looked into. Then the mapping of the strategic needs of the women and also the practical needs of the women. Most of the programs have been focused on the practical gender need, but strategic gender interests have not been taken care of, where that leading to public policy changes, empowerment, leadership, and so on and so forth. So it's not be seen as a kind of a, we are going to give, and many a times they have shown as a leadership and help in reducing risk. So how that they are going to get engaged in a terms of DRR leadership. So that is important to be engaged in. And then collection of gender segregated data and also the vulnerable group-based data in assessing the disaster impact. And the disaster data is, if at all collected, normally it is not collected on a regular basis, but when we are talking about database management, so the gender segregated data and also the data which we are talking about gender budgeting, so that can be included as a vulnerable group-based this database budgeting. So these were the 4 major recommendations. Now coming to the this very quickly on the multi-hazard local capacity building. That multi-hazard local capacity building in terms of that local capacity has been highlighted, and we said that reverse pyramid approach should be taken in the coming 15 years of time. That national, federal level, the capacity has been done, and very good capacity we have in the country. State level also we have been able to achieve, but the local level, the panchayat level and below panchayat level also, at the local bodies level, we have to strengthen. We do not have much of the expertise existing there. So how we are going to build that capacity? Retired officials living in the villages should be mainstream for the capacity building. Many of the retired officials, as a kind of a dividend of those, can be brought into the mainstreaming of DRR planning process. And then 4 I-based principle: indigenous, innovative, inclusive, and integrated. So these were the kind of 4 basic principles for community based on the local capacity building they brought in: indigenous, innovative, inclusive, and integrated. And the value addition based targeted intervention should be taken. Like, just for an example to explain this word, like if there are many, if there are potato growing areas, that why only the farmers would bank on the potatoes alone? Why not that value addition of potatoes go for the chips production and so on and so forth, so that they multiply the products and they get the livelihood and other things can also be addressed. So value addition based target based events, and the communities are not homogeneous, and so the risks are. So communities should be seen differently, should be analyzed differently, and also should be treated differently while we are making plans. So their heterogeneity should be incorporated and understood in when we are understanding risk. So institutionalizing capacity development program and the process and the local governance become part of the system. So another program which we did with the Ministry of Agriculture, drought risk management. Recently they have come up with a drought manual with a revision, NIDM was involved. So we wanted to unfold this and also to disseminate this information. So program was organized. Unfolding manual was to the last mile was the main objective. So, and was the recommendation also that how that drought manual which has been made can be taken to the larger audience in the drought affected states. Integration of ongoing schemes of forestry, agriculture, watershed, animal husbandry, etc. should be taken into account, as we have heard this morning that the annual plan is already there. Inclusion of financial sector and development of financial and insurance product, And baseline data on nutritional status would be developed with the drought-affected states so that the drought dates could be monitored and also be identified that whether it is, can be established also that yes, it is happening due to drought. Sensitization program for the resident commissioners were also on the initiative of the Ministry of Home Affairs was organized, and I'm very much thankful to the ministry which supported. And 23 states were represented by